Hello, once again. Good afternoon, everyone. Thank you again for joining us for our first in the series of the Development Impact Conversation. My name is Clement Chipokolo. I work for World Vision, your co-convener this afternoon, alongside my colleague Rosalia, and I work for World Vision as Operations Director. You might be wondering what this is all about. The Development Impact Conversation is basically a get-together of practitioners in the development world who have an interest on how impact looks like, particularly with the investment that we make collectively as development organizations. And so we seek through this series to be able to share our experiences, to be able to listen from experts, but also engage and inspire each other to do good in the development work that we do. We intend to have these conversations every month, and we'll be inviting experts from different fields that are aligned or have got an influence on the development work that we do. For today, we have a privilege of welcoming Ms. Yuna Liang, who is a senior research manager at IPA, and she's going to talk a little bit about that in her presentation to just share with us her experiences, her technical overview of the importance of M&D in the development programs that we implement. In a minute, or in a second, I'll hand over to Rosalia, who is going to be the anchor for this conversation, and she will just take us through. Thank you, Rosalia.
Thank you so much, Clement, and good afternoon, everyone. My name is Rosalia Dalla Boyd. I am the Communications and Public Engagement Manager at World Vision. A big thank you to everyone who's joined us, and a very big thank you to Yuna for making her time available. Thanks, Yuna. So just general housekeeping rules for this afternoon. We'll have Yuna do her presentation. If you have any questions, please pop it in the question area or the chat box, and then we can come back and revisit our questions at the end of Yuna's presentation. There's also an opportunity for us to have an open discussion, and as the series webinar indicates, it's a discussion. So we're hoping that we can get a couple of questions and engage at the end of the conversation. But Yuna's had a short bio that was sent on the flyer, and we'll hand it over to Yuna to introduce herself and furthermore give us her presentation. Thanks so much, Yuna. Over to you.
Thank you so much, Rosalia and Clement, and hi, everyone. My name is Yuna. I'm a Senior Research Manager from Innovations for Poverty Action. I am calling here from our Manila office, and I'm very glad and excited to meet you all. Thank you so much for inviting IPA into the community of practice of M&E and development programs in PNG. I hope that this is just the first of many more conversations that we would have and many more experience sharing in the future. Perhaps I can start this presentation now. And please let me know if at any point you cannot hear me properly. Please let me know, because my connection here is also not always very stable. And please feel free to ask questions throughout the presentation. So that I can immediately respond to your question. And I hope you can see my full screen and there is nothing blocking it, because I see a few windows here on my end. But okay, yeah, so today I will first quickly introduce who IPA is and what we are doing in PNG. And then a quick recap on what we mean by M&E. I'm sure many of you are already familiar with these concepts, but just to make sure that we are on the same page, speaking the same language. And then we will dive into the main section of this webinar, which is why we think that robust M&E is important for development programs. And I will give a real-life example of that. And then I will also discuss how to build learning-oriented right-fit M&E. And of course, this last point, this whole how question is a big question. And because this is just the first episode of this series, so today I will just introduce a few frameworks that could be useful for organizations to think through how to build a right-fit M&E system. But yeah, if there are more interest into diving deeper into any of those frameworks, perhaps we can explore that in future webinar episodes. All right, so first of all, introducing IPA. Innovations for Poverty Action is an international research and policy nonprofit organization. The reason why we exist is because we see this problem in the development sector, right? There is relatively little investment in discovering what works. If you look at the private sector, it's common that companies spend a large portion of their resources into research and development. While in the international development sector, we still spend less than 1% into testing new innovations or evaluating whether existing programs are working or not. So our theory of change is that the problem that we want to address is that there is little evidence in the development sector on what works best to improve the life of those experiencing poverty. And when evidence does exist, there is also limited use of such evidence. And these then lead to ineffective programs and policies and wasted resources and money and enduring poverty. And our solution to this problem is to design and evaluate potential solutions to poverty problems, and also to mobilize and support decision makers to use this evidence for better programming and policy making. And so that our vision is a world with more evidence and less poverty. And we work towards this goal by three main streams of work. First is evidence generation. So we work with our partners, which could be NGOs, government, private sectors, to conduct rigorous impact evaluations to generate evidence on what works, what doesn't work, and what works most cost effectively. But of course, generating the evidence itself is not enough, right? Because we want to make sure that practitioners and policymakers are really using the evidence. So we also have a policy team. We strategically share evidence and we support our partners in applying this evidence. For example, this could be adapting proven interventions in their own context or to scale up already proven intervention. Right. Lastly, which may be most relevant for the audience today is that we also have a right-fit evidence unit, which is an M&E advisory unit that provides support to organizations to help them build more learning-oriented M&E systems. IPA is headquartered in Washington, D.C., but we have offices in 20 countries around the world. So these blue dots here are the locations where we have country office, and I'm calling from the Philippines office. We've conducted more than 900 studies in many different areas. We do research in any topics. And at the moment, we don't have an office in PNG yet, but we are working towards opening an office in PNG. So in the meantime, we have been building up new partnerships and building up a pipeline of impact evaluation projects. And with funding support from ODAT Foundation, we were also able to organize a few workshops about impact evaluation in Port Moresby in the past year. And we look forward to hosting more such workshops and engaging stakeholders in PNG, and perhaps to invite more of you in upcoming workshops and any other knowledge sharing events. All right, so okay, so going back to the topic of the day. So first of all, what do we mean by M&E? Generally speaking, monitoring and evaluation is the collection, analysis, and the use of data with a highlight of usage around projects and programs for operational management, for learning, and for accountability purposes. Oftentimes we talk about M&E as one, but I'm sure many of you are already aware that the M and the E are two different things. Monitoring is an ongoing process where we measure our progress against our set plans, but this doesn't necessarily tell us the extent to which the results were achieved or the impact of the program, right? Monitoring is continuous, is frequent and routine data collection, and it takes place during intervention, right, when our program is ongoing. But evaluation is an assessment of our program or the policy, which answers research questions that are relevant to key decisions that we need to make to improve the program. As compared to monitoring, evaluation is less frequent, it's more time-bound, and we can evaluate ongoing or completed intervention. But of course, there were different types of evaluations, and they all answer different questions. For example, needs assessment ask what is the problem that we want to address. A program theory assessment asks how in theory does our activity or our program intend to fix the problem that we want to fix. A process evaluation looks at how our program was delivered, whether it's delivered as planned. So it's more on the delivery side. While impact evaluation, in an impact evaluation, we are really asking were the program goals achieved? If so, what is the magnitude, right? What's the magnitude of change? So in a rigorous impact evaluation, we really want to look at how the lives of our clients or our beneficiaries have changed as compared to how their lives would have changed without our program. And lastly, cost effectiveness analysis focus more on comparing different types of interventions that have the same goals, but considering their effectiveness, the magnitude of changes, and the cost, and see which ones are more cost effective. All right. So if we look at monitoring and evaluation along the field of change, where we have our program input and activities leading to intended output and intended outcomes and impact. Evaluation can happen at different stages of the field of change. When process evaluation focuses more on assessing whether our inputs are leading to the output, so more on program delivery. Impact evaluation focuses on whether we are achieving the intended outcomes and impact. Right? And for monitoring, it's more often that it happens at the earlier part of the field of change, more like monitoring program delivery. In some cases, it's also possible to monitor some early outcomes, especially if it's easy to measure, such as changes in knowledge right after training, etc. Okay, so this is just a quick recap of what M&E means and the different purposes of monitoring and evaluation. But of course, both monitoring and evaluation are very important to generate necessary learning for our programs to be more successful and deliver the impact that we want to deliver. So now I will continue to discuss why we say that robust M&E is important for development programs. So first of all, when we have robust M&E that provide us with sufficient data and information, it helps us understand whether the program worked or not. And this is not just a simple yes or no question. Especially when the program did not work, we really want to understand why it did not work. And having a good M&E systems help us solve what we call a black box problem. right? So imagine what is a black box problem. Imagine now the problem that we want to fix is low immunization rates, right? Just as an example. And we have an intervention that we deliver. Maybe it's information outreach, maybe it's outreach by medical teams to communities to carry out immunization. We deliver the program, but then we don't know, and in the end, we find that there is no increase in immunization rate. But we don't know what happens in between. Like if we don't have sufficient data, we don't know what happens in between, then this becomes a black box because we won't be able to know why our intervention wasn't working to increase immunization rate. And more importantly, we would then not be able to make decisions on what actions are necessary to improve our program. So, however, if we do have, oh, it's not going to the next, okay. If we do have a good M&E system that collects data, sufficient data throughout our theory of change, so that we can verify, say, whether our inputs are leading to the output, to the outcome and the goal. And this is what happens if all of this we are achieving all of this, then this is a successful intervention, right? But when the program is not working, it's also important to distinguish between what we call a theory failure and implementation failure, right? If we have enough data to know that actually we were already failing at the output stage, right? Our inputs are not leading to the intended output. Then we know that this is an implementation failure, and the actions that are needed are to like really uncover the implementation challenges and come up with strategies to overcome these implementation challenges. However, if we find that we get the output as intended, however, it is still not leading to the desired outcomes and goals. So this is more what we call a theory failure, right? So the program did not get the impact we want, not because it wasn't implemented well, but because either we are not addressing the right problem, or we are not addressing the most important, say, contributor to the problem. So we are not really moving the right needle, right? So so in this case, we may want to redesign the program and maybe conduct more research on like what really are the underlying problems that we should focus more on addressing. So we will see whether it's an implementation failure or whether it's a theory failure would lead to completely different actions, right? So and this is, we can only make such decisions if we have sufficient data through our M&E system to inform this decision. Sorry. So that's about when we find that our programs don't work, right? And even when we find our programs are working, it is still important to like understand what make the program work, right? What are the important components of the program that contribute most to the impact. And also, as we are all operating in resource-constrained environment, it's also important to look for more effective or more cost-effective ways to deliver programs. And oftentimes, rigorous evaluations can provide surprising insights, especially when it comes to cost effectiveness. And this is just one example in the education sector, right? Here we are comparing a bunch of different types of interventions that aim to increase years of learning for children, including, say, information about returns on education, deworming, school uniforms, cash transfers, etc. But when we have sufficient data, we can then compare the cost effectiveness of these different interventions. And in this case, for example, surprisingly, deworming programs, which originally were more intended for health outcomes, not education outcomes, were found to be actually very cost effective in increasing years of learnings for children. And here the metrics that we use is the additional school years gained per $100 spent, right? So this actually in the evidence field, like this, ever since the evidence was created about the learning impact of the deworming programs, deworming program has been taken up in a much larger scale. There are global initiatives such as Deworm the World. So a lot more resources are being channeled to such cost-effective interventions. And again, all of this is only possible because we have these kind of programs that were collecting sufficient data on the impact of the program and the cost. Right? Okay, so one last point I want to make about this why question is that a good M&E can be an enabler for successful adaptation of program and scale up. And I want to demonstrate this point using a real-world example in the education sector. So as we all know, there is a large learning gap between developed and developing countries. And there have been a lot of innovations in different countries trying to close this learning gap. And here I want you to introduce just two programs, and I want you to guess which program achieved most or more impact at scale eventually. So here is the first program. It's called One Laptop per Child, which is pretty simple. They give one simple laptop, which is like a low-cost version of a laptop that only costs $100 for each child. And the theory of change is that when they have access to this laptop, they can use this laptop to assist them to learn better. And when this program was launched, the founder was so confident about this program that they think there is nothing that they really need to test, right? The days of pilot projects are over. So because they are so confident in this model, the program scaled really fast. In just 2 years' time, more than 600,000 laptops were distributed. So this is one case of scaling really fast. And then the second program that I want to talk about today is called Teaching at the Right Level. This was originally created by an education NGO in India called Pratham. And the model of teaching at the right level is basically a remedial education intervention given to children in primary school who are lacking behind in literacy and numeracy skills, right? It's called teaching at the right level because they group students according to their learning level, right? Not according to their age or their grade. Because commonly in developing countries, you get these large classrooms with a lot of children at different learning levels, and many of them may already be lagging behind so much that they can no longer follow what the teachers are teaching, right? So the innovation here is to group children at their learning level and provide remedial tutoring for maths, for language skills, so that to help these children catch up. So when this program was first started quite a while ago, they took a different approach. So as you can see, in the first 2 or 3 years, the same time that the previous program, the laptop program scale, this Teaching at the Right Level program only operated in up to 20 schools, right? So they took a very slow approach in scaling because they did a lot of piloting and iteration. As according to their research partner, like at the beginning of that stage, they did a lot of measurements and they found no impact, and that's why they kept improving their design and kept testing. So this is one example of scaling slowly, right? So guess which program eventually was more successful, right? So actually, the one laptop per child program were eventually shut down. So I think in 2012, so about 10 years after, okay, sorry, 5 years after they launched the program, someone convinced them to conduct a rigorous impact evaluation. And there they found that actually there was no impact, right? The children were using the laptop, but that doesn't actually translate into better learning outcomes, right? So eventually when this program was shut down, they've reached about 3 million students at a pretty high cost, right? More than $2,000 per child. And there was no significant impact on learning that was detected at all. On the other hand, teaching at the right level, or TAL, this is still ongoing today. They have so far reached more than 60 million students across India, Africa, Latin America, at a very low cost, right? Roughly $2 to $15 per child. And the impact were found to be significant across different countries, different settings, different delivery mechanisms. At about 3 learning adjusted years of schooling per $100, right? So you can see that in this example, a program that scaled fast without first collecting much data to inform their program have lost to one that we call that they fell fast at the beginning, but they collected sufficient data and enough learnings for the program to improve later on, and set up to a more successful path to scale. So it's worth diving a little bit deeper on like how this teaching at the right level program, what did they do, right, throughout their scaling process? What were their practices in M&E and in learning that enabled such a success? As mentioned earlier, at the earliest stage, at the early stage of the program, they spent sufficient time to pilot and understand how well the program's working. And then when they get to a point when they have the confidence that, okay, the program seems to be working well, and they enter what we call a proof stage, right? From ideation to refinement to proof of concept. When they get to this proof of concept stage, they engage with an MIT-based research institute to conduct rigorous impact evaluation using what we call randomized controlled trial methodology to really rigorously measure the impact of the program. And from there, they found positive impact of their program, but they didn't stop just here, right? Because the first model of the program that were tested through impact evaluation was delivered by paid tutor. But then they thought about, okay, how about if we use volunteers to deliver the program? Would that be like equally effective but more cost effective? So they then want another model like of the same program, the same remedial tutoring program delivered by volunteers, and they again use a rigorous impact evaluation to measure the impact, right? And there they found that it is still very effective in improving children's learning outcome. But they also have good monitoring data that show them when they are using volunteers to deliver the program, there are actually much higher attrition rate of the volunteers, right? Because they are not being paid. And also that the take-up is not as high for children who need the program most. So these monitoring data then inform the program to think of ways like how to reduce attrition and increase take-up. And that's when they thought about, okay, what if we use government teachers instead, right? So there could be no attrition, and implement this program in school instead of pulling children outside of school. So because children are already in school, so the take-up would automatically be high, right? So they again tested a different model, like being delivered by government teacher in school, and they again won impact evaluation to see how well it worked. But there, they actually found disappointing results, right? It seems that when the program was delivered by teachers, the learning outcomes were not there. It didn't achieve the same learning outcomes. But as I said earlier, right, when a program is found to not work, it's actually more important to figure out why it did not work. And in this case, again, the NGO had good monitoring data to uncover what went wrong. And in this case, they found that the compliance of government teachers of the program is actually very low, because like teachers didn't really have the incentive to deliver this additional tutoring, and they didn't see it as part of their core responsibility. So through their rigorous data, they were able to identify that the low compliance of teachers was the main factor for the program not being successful, right? So, but then from there, then they were able to see, okay, now what we need is to think of ways to incentivize teachers to really deliver this program and to improve compliance, right? So from there, then they were able to like come up with more innovations, such as assigning regional coordinators to mentor and support the teachers, and monitor their compliance, but also work with government to really mandate this remedial tutoring for students that are grouped at their learning level. Make it as part of the teacher's core mandate, and even mandate like 1 hour of TAR instruction in per week in the school, so that this become a core responsibility of the teachers, right? So from there, they then again run more impact evaluations to see whether whether this additional innovation make teachers deliver the program better, and they define that it works, right? So eventually they were able to arrive at a more optimized ways to scale the program by working with government teachers, but also have sufficient incentive and also monitoring mechanism in place to ensure that teachers are really delivering this program. Yeah, and again, they didn't stop there. They tried to explore more cost-effective way. They explore learning camps, which are like outside of school, but we're only one about 20 to 40 days a year. Is also found equally effective. And then later, this like when more and more evidence were generated about the effectiveness of the program, it then started being scaled up to other countries, starting with Kenya. And today, this model is already applied widely across India, I think in more than 20 states, and is institutionalized, delivered by government, and also in many other countries around the world. Right. So here, this program or this innovation has taken like about 2 decades, right, to slowly scale. But there was so much learning throughout the scaling that they were able to eventually arrive at the optimized way to scale up the program and make it more sustainable. Yeah, so just to summarize, like what we learned from this case study is that a robust M&E system really enable this teaching at the right level program to get necessary learnings at each stage, including the early piloting when they focus on measuring take-up and feedback and early outcomes. At the proof of concept stage, they work with research institutions to carry out very rigorous impact evaluations. They've gone through like 6 impact evaluations throughout their proof of concept stage. And then when they try to adapt it to different contexts, they again conduct more impact evaluation and get rigorous monitoring data. And lastly, now that it's at scale, the focus is more on monitoring implementation fidelity. Right, so this is one example of how having a robust M&E system is not just for accountability, but also for program learnings and for the eventual success of the program. Okay, so sorry. Yeah, so I hope I still have 15 minutes. Okay, I hope by now you're somewhat convinced about why robust M&E is important for development programs. But like I don't want everyone to leave this webinar thinking that okay, we need more robust M&E, and that means we need to collect more data. That is not always the case, right? It's not really about collecting more data or the quantity of the data, but whether we are collecting the right data that we need and that can generate meaningful learnings. So again, I would discuss a few useful frameworks more at a high-level introduction, but maybe in the future we can discuss more about each of this. Sorry. So the first recommendation is to really develop a clearly defined theory of change, and for it to be the basis for your program M&E. So a theory of change is like a pathway where you conceptualize how your program, or your activities, would lead to the intended outcomes or the impact. This usually you would lay out this activity or input or output, and then outcome and final outcomes, right? I think probably some of you have already gone through this for your program. And then in a good theory of change, you will also want to identify critical assumptions at each link of the theory of change. So for example, what are the assumptions that need to be valid in order for this output to lead to these outcomes, right? Identify these assumptions that are critical to program success, and develop indicators for each of these components. And this could then be the basis of your M&E, right? When you think about, okay, what data do we need and what should we collect? And this is something that should not just be the M&E team's job, right? This should be something that you would really want to involve like the program team and other stakeholders such as the donor, any other relevant stakeholders when developing the theory of change. And you want to develop this as early as possible, even at the program design stage. And you want to revisit it regularly throughout the program cycle, because sometimes you may want to update it. Maybe you've already validated some of the assumption. Maybe you found that part of your theory of change is not working, and you may need to change it. Right, so this should be a living document that you come back to regularly during your program life cycle. But again, some of you, especially if you have very complex program or you have multiple programs, you may have a theory of change that is so massive. But can we really measure or check all of this? And should we? Right? The answer is no, because so here is a comic that shows a bad practice when it comes to M&E, that you try to just get all the information, whatever available, without actually thinking how we would use that information, right? This is a bad practice because we all like working resource constrained environment, and M&E data collection can they can be costly at times, right? So we want to make sure that we are only collecting data that we will eventually use. Sometimes unfortunately, which is kind of the norm, is that a lot of organizations tend to collect more data than they could ever analyze and than they could ever use, right? But we want to move away from this to a better practice where we just collect the right amount of data that we will be able to analyze and we will be able to use. And instead of doing this ad hoc, we want to do this repeatedly and on an ongoing basis, right? And the challenge here is that sometimes like we have too little data, which doesn't enable us to have enough learning or to hold us accountable. Sometimes we also have too much data, as I said earlier, which just becomes unmanageable, and you don't even know what to how to add on those data. It's also possible that sometimes we get the wrong data. For example, data that shows our impact but not in a very credible way, or data that comes too late, too slowly, when we already missed that decision-making window, right? So the ratio of the cost and learning, as you can see, we want to reach this right fit portion of this diagram with reasonable cost, but maximize learning. And how do we get there? It's really a matter of prioritizing. And in IPA, we recommend a principle that we call CART, to help organizations prioritize their data needs and their M&E activities. So CART include four principles, like credible, meaning that we should only collect data that we know we will be able to collect them credibly. We can collect high quality data, right? If we don't have the capacity to collect data in good quality, then collecting bad data is just as bad as not having data. And we want to make sure that we only collect data that we know we can analyze accurately. We want to prioritize collecting data that can really inform decisions and think of how we will use the data early enough before we even start collecting the data. We want to consider whether collecting this data, the cost of collecting the data outweighs the benefits, outweighs the cost. And also lastly, whether this data can generate transportable insights that would be useful for not just one program or one contest, right? Imagine, think about that teaching at the right level program we discussed earlier. The insights that were generated in that program eventually benefits many organizations implementing similar programs in the world. I cannot get into too much details about this. Sometimes we have multi-day workshops with organization, walking them through this prioritization process. But if you want to know more about the CART principle, I would recommend that you can read this book called The Goldilocks Challenge. It's co-authored by Dean Callan, who is our IPA's founder. He's currently the chief economist at USAID. You can also find more information on our website about our Right Fit Evidence Unit. Yeah, but of course, I can also discuss this more in future webinars if there is interest. All right, so that's the second point about using CART principle to prioritize what data to collect. And then lastly, you can also use a path-based framework to guide you through the prioritization. Because like programs and organizations certainly have different data needs according to where you are in your program, right? Just like what we discussed earlier, the teaching at the right level program. When you go from ideation to refinement to proof of concept, adaptation and scaling, the needs are different. And you want to focus on what's most important for each step. To give you some example, these are really just examples. I'm not saying that for each stage, you should only collect this data. Of course, that takes more careful consideration given the different context of different programs. But like just as an example of how to apply this path to scale framework, say at the ideation stage, usually like our objective is to identify challenges and understand our users. Here, we can rely more on literature reviews and user testing. User testing meaning some really small scale, maybe A/B testing, very small piloting, to get the feedback from the users, right? We don't, like here, matches is not very important. It's not as critical because we want to ideate fast, right? Get fast feedback and fast improvement of the program and then keep testing. At the refinement stage, that's when we want to assess the quality of execution and identify signals of success and failure. Usually we would want to do some piloting and collect sufficient monitoring data. And because we are still at the refinement stage or the pilot stage, it's not yet the right timing to measure impact, right? Because we don't even know whether the program, the implementation or the operation is working well yet. So here, instead of impact, we can focus more on like product and service take-up, more early outcomes, user feedbacks, right? And one example, say if we are running a training program to improve employment rate, then in terms of take-up, we can think of like the attendance in our training. In terms of early outcome, we can look more on like the comprehension or the knowledge, right? Just the immediate outcome of like whether people understand or absorb the knowledge that we were trying to teach. And then user feedback, such as like how likely Net Promoter Score just means that how likely would people recommend this training to someone else. Yeah, so this is at the piloting and refinement stage. And then when you get to the proof of concept stage, that's when you really want to demonstrate impact, and that would be the right timing to conduct rigorous impact evaluation. We can have a whole session about what impact evaluation is more rigorous, but here you would now want to focus more on the final outcomes, right? Such as the actual change in employment rate among the people that you serve or your beneficiaries, as compared to those in the control group. And then like once you get through that proof of concept stage and you know that your program is working and it has the positive impact as you want, then you may want to adapt this program to different context, or maybe add something new to the existing model. So here you want to test the applicability of the model to the new context and see if you have any new adaptation, if it's still effective, right? So here, again, you can do more piloting and do more rigorous monitoring and user testing, and you will be focusing on the same metrics such as take-up, early outcome, user feedback. If you are very committed to finding out what is most cost effective, you can also measure impact here so that you can compare the different models that you are testing, which one is more impactful with less cost. Yeah, and then lastly, once the program is so mature that the impact has been tested multiple times in different contexts and is ready to scale, then like you don't want to stop collecting data, right? You still want to see whether the program is being implemented well at scale, right? And here, what would be most important would be to conduct ongoing monitoring. Again, you may want to still look at take-up, right? When you scaled it, is the take-up still high? And perhaps look at more early outcomes, right? So the whole point is to even when your program is mature enough to scale, you still collect the right data to see whether the program is being implemented well at scale. So again, this is just example, and if you have specific program in mind, you can think deeper into your needs for data using these three frameworks that I discussed earlier. Okay, good. We're good with time. Okay, so just to summarize, I know I've been talking a lot and giving a lot of different new concepts, perhaps. But to summarize, I hope the key takeaways from today is first, we want to consider M&E beyond accountability, right? I know that's the topic of today is about M&E for development program accountability. But of course, we can think of accountability beyond just being accountable to donors, but in a more broadly defined term, as in being accountable to delivering impact for the population or for the beneficiaries. And M&E, like good M&E system can be an enabler for learnings that assist us to better achieve such impacts. M&E should be an iterative process, starting with developing a theory of change, and we will want to involve relevant learning parties early and throughout the program life cycle, so that, say, decision makers or the program team, they have ownership over the M&E, and this is not just something that the M&E team work in separately, independently on, without involving other stakeholders. We will want to prioritize data that we can collect and analyze credibly, and that will bring actually actionable insights, and that we are committed to act on. And we will want to aim for what we call right fit M&E that is more learning oriented, right? Beyond just satisfying reporting requirements to donor. And that the right fit M&E should be suited for the stage of our program throughout the path to scale. Yeah, so that's my last point. And I see that there are questions in the Q&A session. Rosalia, are you going to MC the Q&A session, or should I just look at these questions and answer them?
Thank you, Luna. You can perhaps just answer the questions.
Okay, sure. So a question from Simon: the program on children having access to laptop can be seen as a failed project. Does that fall under implementation failure? I think I would say that example is probably a theory failure, because if we look at what implementation failure means, right, that means that the input is not leading to outputs, right? But in that case, we know that the laptops were actually distributed and the children were using the laptop, but still there was, so inputs and outputs are there, but that didn't lead to learning outcomes. So I think that is more a theory failure than implementation failure. And then second question also from Simon: each of the development organizations have internal sector, such as education, WASH, livelihood indicators for data collection for internal reporting, while different programs have different indicators for program level data collection. That sometimes lead to too little data, wrong data, or too much data. Okay, so I think this is a comment, not a question. But yeah, that's a good point. That sometimes there is just misalignment, right? There are organization level indicators, there are program level indicators, there are like reporting requirements, there are this requirement and that requirements, and sometimes that could be the reason why like we just have so much data that we don't really know how to use. And I think this is a good point, and it I think that just leads us to the importance of how, like, in order to make M&E truly learning oriented, that we need to involve relevant stakeholders, right? This is not something that only a program or an organization themselves can achieve. This is something that we want to get buy-in from different stakeholders, like implementers, donors, policymaker, researchers, so that everyone have that buy-in that M&E is important for the resources that go to M&E to really inform learnings and be useful for program success. Okay.
Sorry, Yuna, I'm not sure whether it's a comment or a question, so from Nikki.
Oh, Okay, yeah, Nikki, M&E oriented towards learning and improvement is important. I think most times, usually small CBOs that we support peer evaluation. Thinking we are asking for evaluation solely for accountability purposes, which is right, but not always the focus is for their learning. Yeah, that's super important, especially as IPA specializes in impact evaluation, and we conduct a lot of impact evaluations around the world with different organizations. So I certainly agree with you that buy-in from the implementation partners is super important, that they also see the evaluation as for learning, not just like a validation or audit. One way in our experience of building such buy-in is to come in early, right? So if you have a program that is already completed and now you commission like a third-party evaluator to evaluate the program, and then and the evaluator may come up with a report and then just leave, and that's it. That may be a situation where the evaluation is seen more as a validation or audit. A more like a better way of incorporating impact evaluation in program and the learning cycle is to already start designing an impact evaluation at the beginning of the program. Oftentimes when we work with partners, we start designing the impact evaluation before the program even roll out. And that way, we get the trust and the buy-in from the implementation partners, that the evaluations are there to answer the questions that they have and that they want answers to, and is there to help the programs to learn and perform better. Yeah, we can certainly maybe have another session talking about impact evaluations and challenges and best practices. I'm just trying to see if there are any other questions in the chat, but I think that's it. I may just open this for discussion then. Does anyone have any comments or insights to share? Or Rosalia, maybe I should turn it back to you to MC.
Thank you, Yuna. Yeah, I think that's a great idea. If any of our participants have any comments or questions, please feel free to post it in the Q&A box or in the chat, and we can just respond to that before I give just a quick highlight summary overview of the presentation. And then we can, I know we're all very busy, so we can close things off. So we'll give it another minute just to see if anybody has any questions or comments. I think there is one, Yuna.
Oh, let me see. Can you share the PowerPoint presentation? Yes. This is an easy question to answer. Yes, I will certainly share that. Yeah, and if there is any suggestions on like how what else would be useful, maybe for future webinars, please feel free to also let us know.
Okay. So thank you very much to Yuna. Thank you very much for the informative presentation. Just as a quick summary before we close things off, and if you have any questions, you can perhaps share them with myself or Clement, and we can forward them on to Yuna. And we're very grateful for your time, Yuna. So I'm just going to give a quick summary of the presentation. So Yuna gave us a definition of M&E, and specifically what they allude to or what the definitions are, with the different types of evaluations, posing to us 5 questions. She also stressed on the importance of the theory of change and how M&E is intertwined in the theory of change, giving the example of the black box problem, which is quite interesting because there's a distinction between implementation failure versus theory failure. And I think maybe perhaps as development practitioners, we do not really appreciate that. Yuna also spoke to impact at scale. It was very interesting to see the correlation between the tile and the 1 laptop per child example that was given. Sometimes slow and steady has a tendency to have a higher impact than short and fast. So I think perhaps the key learning there was over time adjustments were made to increase impact, to enhance outcomes. So the success of teaching at the right level, programming, was continuously monitored and evaluated to adjust and increase impact. So it's a process that's ongoing and a continual process. It's not just a one-off. Sometimes the perception of M&E here, perhaps in a grant space such as PNG, where we have a lot of donor funding, could be the fact that it's a validation process for used by our donor partners. But I think the summary points clearly state, the development of a clearly defined theory of change is very important. Too much, too little, maybe wrong data. So not necessarily collecting a lot of data is a good thing. It may not be in some instances. The use of the CART principles to prioritize, and the use of path-based measurement framework as a guide for path to scale. So I think some very important and perhaps not so new concepts, but presented in a light where it's a bit better understood. So we know, like, for example, the implementation failure versus theory failure. So I think in the space that we work in, it's quite interesting to hear about this. And I suppose it would have been nice to have some government counterparts join us as well, because I think that slow and steady over a long period is very applicable in that setting where it's a government policy or a theory of change over a long period of time. But very grateful for your time, Yuna. Thank you for presenting for us, and very grateful to all the participants who joined us this afternoon. I will be sharing a link for the recording as well as Yuna's presentation. And as Clement stated initially, this is a series that we're hoping to just create an exchange of ideas and a discussion where development practitioners, not just M&E people, but anybody involved in that space can come together and just have an open discussion about, what works best, and look at the learnings from, people who have done it before, what's been done before, and experts in that field that can share their knowledge with us here. But I think apart from that, thank you very much, Yuna. Thank you very much to all of our attendees who joined us this afternoon, and wishing you all a lovely afternoon. And there will be another series on this event, and we hope that Yuna will join us in the coming months for another. If there's a specific area we'd like Yuna to elaborate on, more than happy to invite her back with regards to that. But I think if there's nothing more, we won't take any more of anyone's time. Thank you so much, everyone.
Thank you so much. Hope to see you again.
Thanks, Yuna. Okay, have a good afternoon.